Hello, good afternoon, and welcome to our panel, Before Roe, the History and Future of Abortion Access for University of Michigan Students. I'm Anna Kirkland, and my pronouns are she and hers. Thank you for joining us, whether you're here in person or Zooming in. I'm the Kim Lane Shepley Collegiate Professor of Women's and Gender Studies. I'm pleased to welcome you on behalf of IRWIG, the Institute for Research on Women and Gender. I supported this research in my role as immediate past IRWIG director and as a member of the university-wide Post-Roe Campus Community Working Group. Before we begin, please note, this event is being recorded. For those on Zoom, we are putting our guidelines for virtual participation in the chat. We organized this panel in recognition of the dramatic historical moment that we're in right now after the Supreme Court just overturned Roe v. Wade. We wanted to learn from the last time there was no Roe v. Wade, and that was when abortion was illegal in Michigan. The university had a robust response to that moment, just as it has had to the moment we are in right now. Brianna Johnson-Levy has written a remarkable report about what UM did before Roe, and it's publicly available in our Deep Blue repository. We'll drop it in the chat for those on Zoom, and others may find it most easily linked on the IRWIG webpage describing this event. I want to give a big thank you to the archivists at the Bentley Library, especially April McKay, and to Women's and Gender Studies librarian Meredith Kahn for sparking this idea, the Office of the Vice President for Research, and members of the Post-Roe Campus Working Group for bringing us together today. I'm pleased to introduce our panelists. Let's see. Sorry, I'm trying to advance slides at the same time here. Okay, how do I? Oh, that's what I tried. Well, we'll see. Is this? It was working. Okay, is that it? Okay, we're good now. Okay, sorry about that. I can't advance slides and talk at the same time, as it turns out. That's actually not a big surprise. Brianna Johnson-Levy was born and raised in Ann Arbor, Michigan. She's a PhD student in the History and Women's and Gender Studies Joint Doctoral Program. Dr. Christine Asidao is the Associate Director of Community Engagement and Outreach and a licensed staff psychologist at the University of Michigan Counseling and Psychological Services. Her clinical areas of interest include the effects of multiple social identities on psychological well-being, identity development, family of origin, second-generation immigrant issues, grief and loss, and eating disorders and body image. Dr. Laura Blake Jones has served as Dean of Students at U of M since 2009. In this role, she oversees a variety of student life units, programs, and services within the DOS office and beyond. Fraternity and sorority life and student legal services are additional departments reporting to the Dean. Brianna will begin with a summary of her findings from her research in the University of Michigan archives, followed by a conversation with Dean Blake Jones and Dr. Asidao. There will be time for questions from the audience at the end. For those in the auditorium, please submit questions via text message to the number on the screen as you think of them. And for those on Zoom, please post your questions in the Q&A. IRWIG staff will be watching for your questions throughout the event, and we will get to as many as we can. Please bear with us as we try to run a truly hybrid event. We're structuring the Q&A like this to even out the experience for those in the room and those on Zoom. Now, please join me in welcoming our panelists, and I'll hand it over to Brianna. Hello.
Thank you all for joining today to discuss the history and future of abortion access for University of Michigan students. This part of our time together will focus on the history before Roe, the University of Michigan Task Force for Problem Pregnancy Counseling. As you heard from Anna, this summer, the University of Michigan formed a post-Roe task force to address the impacts on students, teaching, and Michigan Medicine Health Services should Michigan's abortion ban go into effect. Part of the work of the post-Roe task force has become to delve into the history of the University of Michigan, to ask, How did the university approach abortion access in the years before Roe v. Wade, the last time the abortion ban was enforced? Are there lessons there for today? The answer to this question lies in part at the Bentley Historical Library, the archives of the University of Michigan. Over the summer, Bentley archivists, as mentioned before, Caitlin Moriarty and April McKay, identified materials belonging to another historical pre-Roe task force, the Task Force for Problem Pregnancy Counseling. The Task Force for Problem Pregnancy Counseling was formed in the years leading up to Roe v. Wade and led by staff members working within the university's Office of Religious Affairs. Beginning in 1970, following the legalization of abortion in New York State, the Office of Religious Affairs began referring students, faculty, and staff to abortion clinics in New York City. The Office of Religious Affairs would quickly recruit counselors from across the university to join the effort and eventually would collaborate with local social services organizations, medical clinics, and women's groups in Ann Arbor to become the Task Force for Problem Pregnancy Counseling. While today I'll be focusing on the pre-Roe years, the work of the Task Force for Problem Pregnancy Counseling would continue after Roe v. Wade, as Michigan's first abortion clinics opened their doors. The task force would lend their expertise to these clinics, conducting evaluations and providing recommendations that would improve the quality of care for many Michiganders, even those unaffiliated with the university. For many in the audience today, pieces of this story will sound familiar. This is a local story happening in the near past. While abortion is still legal in Michigan, this history is our precedent for the current moment. And it is largely a hopeful story. Before Roe, University of Michigan administrators and staff acted courageously to ensure students access to safe, legal, and affordable abortion care. This history will evidence in many ways the necessity of the university carrying this component of student care into the future, which leads us to ask the two questions I have up on the slide. How did the Task Force for Problem Pregnancy Counseling come to be? How did it gain institutional support? For this presentation, I'm going to focus these questions into a larger one. How did the University of Michigan come to see abortion as an essential care service for its students, faculty, and staff in the pre-Roe years? When I say essential care services, I point to the other care resources the University of Michigan provides its students. Now we think of access to healthcare through the University Health Service, counseling and therapy through what we now call CAPS. In the time when abortion was a crime, how did it become at the University of Michigan another student service? Okay, let's start at the beginning again. The Task Force for Problem Pregnancy Counseling at the University of Michigan found its origins, perhaps surprisingly, in New York City. In 1967, more than 20 New York City clergy, representing diverse Protestant denominations and branches of the Jewish faith, came together to found the Clergy Consultation Service on Abortion. The clergy were brought together by their shared concerns about social justice. Many had collaborated together to support the civil rights movement and to advocate for the integration of the New York City public school system. They viewed the illegality of abortion as another issue of inequality. Therapeutic hospital abortions were only available for those deemed worthy in cases determined medically necessary by hospital boards. The clergy found through study that women's access to therapeutic abortion had less to do with medical necessity and more to do with her respectability and the networks she was a part of, whether she was white, rich, privileged, and married. This left single women, the poor, and women of color to seek abortions from those operating without oversight or legal approval. At the time of the founding of the CCS, which is 1967, the clergy cited that Black and Puerto Rican women made up 94% of abortion deaths in New York City. The CCS was meant to remedy these conditions of disparity and inaccessibility. Based on legal advice from Arya Nair, the executive director of the New York ACLU, and Ephraim London, a constitutional law expert, the clergy began directing women to abortion practitioners in New Jersey that the clergy had previously vetted and negotiated prices with. The CCS and their lawyers believed that sending women out of state decreased the likelihood of clergy being prosecuted, as any case brought would have complex, diverse jurisdiction issues. The clergy worked diligently to avoid any appearance of legal impropriety. The CCS had no office, no board, no trustees, only a phone line that women could call to connect with clergy members. No money would pass within this group. By no means, though, were these clergy operating in secret. They announced their effort in the New York Times, knowing they would only reach those who needed them with real publicity. They hoped their positions as clergy would protect them from police scrutiny. They were well aware of their moral authority and sought to lend it to the women seeking abortions. The illegality of abortion was a problem they felt implicated in. Howard Moody, their spokesman, wrote, "Those of us clergy in New York City who had gathered together at the Washington Square Methodist Church in the early spring of 1967 did so out of some strong convictions that the leadership for the reform of that heartless and inequitable law should come from those of us who preach justice without demanding it and admonished mercy without giving it. It seemed to us only right that the counseling, encouragement, and assistance which women needed under this unjust law should come from that institution, the Christian Church, so responsible for the origins and perpetuation of that law." The work of the Clergy Consultation Service on Abortion resonated with clergy members across the country. In 1967, the California Committee on Therapeutic Abortion sent ministers to New York to study with the CCS. By 1968, there were groups in New Jersey and Pennsylvania as well. In 1969, the Michigan Clergy for Problem Pregnancy Counseling, also called the Michigan Clergy Consultation Service, would begin their referral work, primarily sending women for abortions in Chicago, taking advantage of diverse jurisdictions, just as the New York CCS did. There was a great need for their work. When reflecting on the first years of the Michigan clergy effort in February 1971, Reverend Alden Hathaway, chairman of the group and pastor in Bloomfield Hills, shared that the service had referred almost 15,000 women in 1970 alone. The Ann Arbor coordinator for the MCPPC was an Episcopal priest named Bob Hart. Hart's politics aligned with many of the clergy out east. He was a committed opponent to the war in Vietnam and an active supporter of the Black Action Movement, BAM, at the University of Michigan. Most pressingly for our story today, he was also the director of the university's Office for Religious Affairs. In 1970, in partnership with Len Scott, the counseling director for the office, Hart would bring clergy consultation and counseling to the University of Michigan. This bears the question, though, was this legal? Yes and no. The clergy counseling services offered on the fringes of legality. When clergy counseling came to the University of Michigan, this would have to change. Fortunately, in 1969, at the time of their founding, the Michigan Clergy for Problem Pregnancy Counseling sought legal advice from the law firm Dykema, Wheat, Spencer, Goodnow, and Trigg. Dykema advised them, in a memo you see an excerpt of here, that the Michigan abortion ban, which prohibits both providing and facilitating abortions, does not apply to abortions performed in legal jurisdictions. This memo would help the Office of Religious Affairs to legitimize their intention to publicly do referral work as New York State opened up as a legal destination. The memo was circulated among University of Michigan administrators and University General Counsel. University lawyer Roderick Dane would affirm Dykema's advice, stating that the principal problem with the abortion counseling was political, not legal. The Office of Religious Affairs followed this advice: stick to legal jurisdictions. Beginning in 1970, they counseled students, faculty, and staff and provided them with information for select abortion clinics in New York City. During the New York years from 1970 to 1973, counselors would meet with around 300 women annually. The vast majority, around 85%, would choose abortion. The first clinics used for referrals were the Center for Reproductive and Sexual Health, known commonly as Women's Service, and the Eastern Women's Center. Women's Service was founded by Dr. Hale Harvey, a physician who had come to New York specifically to work with the CCS. Eastern Women's Center was modeled on Women's Service. Even though these clinics were affiliated with the CCS, which was by then a national organization, the Office of Religious Affairs and the Task Force for Problem Pregnancy Counseling insisted on visiting the clinics in person to evaluate their services. In the fall of 1972, Len Scott and Dr. Richard Murray, a gynecologist with the University Health Service, spent 2 days at the clinics, observing the quality of their waiting rooms, laboratories, and counseling services, as well as the safety of their procedures and emergency protocols. Scott and Howard were in close contact with the clinics, eventually establishing a pilot program with the Eastern Women's Center and Madison Avenue Hospital to provide University of Michigan community members exclusive access to affordable abortion procedures after 12 weeks. Scott would also negotiate prices on behalf of the women task force members counseled. Legal abortions in New York were not cheap at this moment. At Women's Service, abortions were regularly priced at $125, which in 22, before the current moment that we're in right now, would be around $910. At the Eastern Women's Center, they were $150, which today would be over $1,000. While these prices are enormously steep for many, at clinics unaffiliated with the University of Michigan, an abortion in 1970 before 10 weeks cost at least $575, which, if you're following my math, would be over $4,000. This price is actually closer to what women were paying around the country for illegal abortions. After the legalization of abortion in New York, it became clear that abortion care could be quite profitable for doctors who could impose on women required hospital stays and expensive, unnecessary anesthesia. In New York, for-profit abortion clinics and commercial referral services sprung up quickly. Many of these for-profit clinics and referral services began to advertise in the Michigan Daily, starting in fall of 1970. Soon, the mission of the Task Force for Problem Pregnancy Counseling became not only to guide students to safe care, but to protect them from economic exploitation. All of this, of course, brings up the question of whether the University of Michigan provided any financial assistance to women seeking abortions. Only one document I found in the Bentley Library spoke to this question. In 1972, Len Scott wrote to the task force with information about university financial aid. Scott wrote that the Office of Financial Aid would consider requests from enrolled students for emergency short-term loans to cover unexpected medical expenses. While he did not explicitly state that these loans could cover abortion care, he suggested that these loans were generally easily approved and could amount to several $100s. Scott listed out the names, genders, and races of the financial aid counselors students might encounter, providing problem pregnancy counselors some of the information they would need to prepare their counselees. This is a moment to consider how the task force had to function within the University of Michigan and the state as a whole. While dealing with an issue as sensitive as abortion, some things just could not be written down. At the same time, much of Ann Arbor knew of the counseling at the time it was occurring. Like the CCS before it, the task force needed to publicize its work in order to reach those in need and to make sure to outmarket those who were hoping to overcharge students for abortion care and services. Beginning in the fall of 1970, information about problem pregnancy counseling was included in the orientations of incoming students. Bob Howard published an article in the Michigan Daily encouraging students in need of abortion care to contact reputable abortion referral services. By December, public service announcements began to run on the campus radio station, WCBN. Eventually, posters providing problem pregnancy counseling information were posted in all of the campus dormitories. The task force included membership across campus, even having representation from the housing department. This amount of publicity, of course, led to some backlash. I'll speak today about the writings of one disgruntled alumni, Dr. Thomas Quinn. I mentioned Dr. Quinn not to emphasize the criticism of the counseling program. While there was a handful of equally displeased alumni, there was very little public or administrative disapproval to be found in the materials saved at the Bentley or in the Michigan Daily. The program was popular. When Len Scott went to recruit the counseling department to join the work of the task force, all 20 counselors enthusiastically signed up to participate that day. I bring up Dr. Quinn because of the response he got from the university. While Quinn originally wrote to then President Robin Fleming and the university regents, Quinn's letter received replies from Robert Noss, the Vice President of Student Services, Dr. Robert Anderson, the now disgraced Director of the University Health Service, and Len Scott, the Chairman of the Task Force for Problem Pregnancy Counseling. In this moment, administrators and staff from across the university came together to articulate the university's investment in abortion care. Vice President Noss responded to Quinn's concerns from the perspective of a seasoned administrator. He wrote, "Our counselors are available to the students as a student service and to provide them with information and services that are needed. No particular point of view or approach is forced on any student." Throughout his letter, Noss emphasized the service that problem pregnancy counseling provided to the student body, to students who would seek abortions without support or education, were there to be an absence of care. The attention to what women needed and what they wanted for themselves was at the heart of the counseling philosophy developed by Len Scott and his colleagues. Scott wrote to Quinn to clarify how the counseling and referral process was driven by women, not by university counselors. He wrote, "Our approach to counseling is to raise various dimensions of the given problem and provide information and facts appropriate to various alternatives for solution. We assume the moral integrity of the people we see and view ourselves as aids to their own decision-making process for which they take responsibility." The counselors set aside their personal beliefs to allow women to make moral judgments about whether abortion was right, morally and in their lives. Like the CCS, the counseling process shared moral authority traditionally reserved for clergy with students seeking abortions. Once a student made a decision, it was the ethical responsibility of the counselors to help women find safe, affordable, and legal care. Scott told Quinn in a second letter, "It would be a mistake to withhold good counsel and information from those who need it, because to do so presently removes these persons from all guidance whatsoever. Presently, women in Michigan have virtually no abortion resources in Michigan. If they are decided about an abortion, they in fact need the assistance of physicians and counselors to find their way to a facility which will provide them medical and psychological care comparable to any other medical procedure." In his articulation of the need on the University of Michigan campus for abortion resources, a cause that stretched across the state. Scott announced the place of abortion in this moment as a need for women like that of any other medical resource, which the university was then bound to provide. It was an issue of safety, of empathy, of morality, and as the clergy counseling movement raised before, access and equality. So we return. How did the University of Michigan come to see abortion as an essential care service for its students, faculty, and staff in the pre-Roe years? Clearly, there are many answers to that question. Religious professionals led from within, bringing the practices and politics of the clergy consultation service on abortion to the University of Michigan system. The task force was able to show the university that it could operate legally and respond to outside criticism. The task force services provided students an affordable and safe alternative to for-profit abortion clinics and commercial referral agencies, protecting them from exploitation. Most importantly, the task force and its counseling care centered the needs of students, providing support for the vulnerable in a time when care was otherwise largely inaccessible. As we think now of our current moment, post Roe v. Wade, we have an opportunity to again reflect on what the University of Michigan can do to address the needs articulated and defined by the campus community, on how we can ensure that safe, legal, and affordable care remains within reach for all those who choose it. Thank you. All right, I'll move us back to the questions.
Those who are panelists for their responses, and then we'll do the Q&A. You want to start?
Just want to say thank you to Rihanna. That was a fantastic presentation and a wonderful paper. So once again, I'm Dr. Christina Zito. I'm the Associate Director of Community Engagement and Outreach at Counseling and Psychological Services. It's really great to be here. I do want to let folks know that I have vocal cord challenges, and so my voice goes in and out. If you need for me to repeat anything, please just let me know. All right, so in terms of resources, just wanted to give you a little bit of an overview of what we provide at CAPS. We focus specifically on our students, both undergraduate and graduate professional. Our office was formerly named Counseling Services, and that's what was being referred to in Rihanna's paper. We are now known as CAPS. So we are located on the 4th floor of the Michigan Union. We also have embedded therapists spread throughout our campus in the 18 out of 19 schools and colleges. What we really focus on is providing individual therapy as well as relationship therapy and group therapy to our students on a wide variety of matters, including really looking at their own health and decision-making that they may be going through. We also provide a variety of different workshops, and we also have places where students can actually just drop in and relax through our wellness zones. So leaving just a little bit of information up here in terms of what is offered to our students. In a little bit, I'm actually also going to give some reactions to Rihanna's paper, but I want to make sure that everyone knows the various resources available on our campus. So I'm going to turn it over to Dean Blake Jones.
Thank you, Christine, and thank you, all of you here in the audience and those that are participating virtually. And I want to add my thanks to Rihanna for the tremendous research and the ability to sit in the seat that I have as Dean of Students at this institution and be able to benefit from the rich history and the information that's been put together to inform our current practice is invaluable. So I, like Christine, I'm going to share some resource information because in any setting like this, I think it's important that we do that. Also going to, I'll respond to questions in a minute, but one of the things that was asked of us is, if we go from the past to current day, how similar or dissimilar is the work that we're doing on campus today? And I will say that while certainly student affairs practice in our campus has evolved and changed in lots of different ways, names of offices have changed, and some offices that were here then are no longer here, but have morphed into different sorts of relationships. The practice of centering the needs of our students at the heart of what we do in the Division of Student Life is a North Star in terms of our practice. And I saw many, the evolution of it and its germination in the paper that was written. So this summer, when we learned, and even before we were sure that Roe was going to be overturned, as you know, the task force was formed. And we immediately began asking, and it was at a time of the year when many of our students were not necessarily in Ann Arbor, began asking, how do we need to reach out and connect to and engage with our students? And so as you see on this slide, we held, because of the benefits of Zoom and being able to work that the pandemic taught us with our students, no matter where they are, we engaged in listening sessions to seek student feedback on what they were most concerned about, interested in, and what they wanted us to know. And so to roll up that feedback at a high level, they were seeking information. Students were all over the country and all over the world at that point in time. They were trying to follow and stay abreast of what was happening. They wanted to know information very specifically about access to reproductive health care in the state of Michigan and on campus during that time. And they wanted to know about questions about the coverage of services, whether that was the extent that insurance would cover or other questions about the provision of services. So those conversations were funneled back to the task force and formed a lot of the work of the task force, and listening circles with some of the same and different groups of students are also happening right now and through October. Coming from what we heard from students, a number of communications campaigns and communications resources have been launched. On that earlier slide, you saw that the public affairs website, as in any issue of emergent concern, there's a key issues page for public affairs, and we direct people to the public affairs website. And so that website continues to be updated and can be a place that we point people to for access to information. The health service also, in terms of their gynecology services and sexual health web pages, have been updated and will continue to be updated, and a specific social media campaign on reproductive health, and particularly answering questions via social media around emergency contraception, or as many people commonly refer to as Plan B, versus the difference between that and a medication abortion and a surgical abortion. So all of those were things that students were telling us they wanted more information about and wanted to understand more clearly. Additionally, this slide just walks you through what is currently available at the University of Michigan Health Service. So there are video visits available and e-consults for contraception options. There is increased access to long-acting reversible contraception, or LARC. There's care for early pregnancy and complications following an abortion, and there is patient care and referral for abortion. One of the things that we were very focused on early on, and we're still continuing to work on, is the availability of emergency contraception. And so, as many of you likely know, Plan B, or I can't say the actual names of the drugs and get them right, so I'll just abbreviate it in that way. That is available over the counter in pharmacies. But again, in terms of cost and affordability for students, that can be at a pretty high cost of about $50, is my understanding. And so access through the University Health Service through the pharmacy is at cost for what the university is able to get the medications for. And so what we wanted to do is be able to share that more broadly for students that might have need for that. So currently, we've expanded the services for the ability to buy Plan B in our convenience stores that are located in various locations around the campus. And we're looking at the ability, as some institutions have done, to have vending machines, because that affords even more anonymity and 24-hour access. Our convenience stores are open quite late, but not 24/7. And so we are looking at that, and it would not just be a vending machine that only had, for example, Plan B in it. It would be a variety of health and well-being, over-the-counter medications and things that students might want. Finally, actually, I have 2 more slides, but I'm going to go quickly. The support that we have for pregnant and parenting students includes a wide array of things, much like the paper chronicles. And for many students who are parenting, having the availability of family-style housing, the ability to live with a family, with your family while you are on campus, is a pretty common thing that most universities have. We also, as many of you may or may not be aware, have a child care subsidy for students who are parents and obviously have limited ability to work beyond the research and other work that they might be doing academically. We have direct support for students, and this is very similar to what we heard about in the paper, that is based on individual need. And the Dean of Students Office is one of the key places that individuals who are experiencing an unplanned financial need of any type has always been able to come to. So I hear that folks don't always know that, but we rely on our colleagues across the campus and our partnerships with faculty and other staff to promote this. And we're not the only office on campus that has emergency funds. The Center, CEW Plus, has robust emergency funds available. Our office, as well as each of the 19 schools and colleges, have emergency funds. Some of them have regulations around what their funds can or can't be used for. And all of us need to work through, as a state institution, and given that many of our students receive federal financial aid, we have to work through the Office of Financial Aid as we consider the amount that can be awarded to students. In this case, that might flag for you a worry. What I can tell you is that an unplanned expense for a medical procedure typically would result in a budget adjustment for someone who is on financial aid. And then the ability for these emergency funds to provide that assistance is how that all works. I'm really boiling it down and simplifying it, but what's important that you know is that we consult with financial aid. We, of course, are complying with all of the federal regulations and rules around that. And then the university ombudsperson is also a confidential resource where students can go to receive support. There was a lot of talk about the impact of the clergy before Roe. And what I will say is that's one of the things that has changed a little bit. We no longer have an Office of Religious Affairs. I think that's what it was called. But we do have an active partnership with the clergy in the greater Ann Arbor area. And they have an association that, it's a voluntary association that various clergy members join, and it's called the Association for Religious Counselors, or ARC. And so the university still has an active partnership there. We certainly have an active partnership with community providers, with ancillary healthcare facilities around the area. The referral out for medication or surgical abortion locally to Planned Parenthood and to other resources is a commonplace service. And the last thing I want to say, actually, I forgot I had this slide. I was telling you all about the emergency funds. This slide just really walks you through that. So that this presentation also expands beyond the boundaries of the topic we're talking about today. If you ever know of a student who is in need of financial support for any reason, these funds are available, and students should be referred either to their school or college or to the Dean of Students Office or CEW. And no matter where they start, we all come together and partner, because individually we can usually only do so much, but together we can collectively usually support students to meet their needs. So I will stop there because I know we'll be getting other questions. And if I go to the next slide, it's the question slide.
Great, thank you. So as the questions are coming in, I will just start with one before we get questions from the audience. So
reading this report, we see so much has changed in higher education since the late 1960s and 70s. So thinking about your own duties at U of M, what struck you about the way administrators and counselors did their jobs back then versus how you do them now? And I'll start with Dr. Asadayo.
Thank you, Anna. So what strikes me is the continued commitment to student care, access, and social justice demonstrated in the late 1960s and early 1970s by U of M administrators and counselors, and how it continues to be demonstrated in 2022. I was especially struck by the letter Len Scott wrote. As I mentioned, we used to be known as Counseling Services. Len was also a long-term CAP staff member back then. So what he did, he beautifully and powerfully outlined what a mental health provider's role is in helping a student work through a challenging concern or decision to make. It's about exploring the many nuances, the context, which may affect how a decision is made. Just like then, as it is now, it's about understanding the intersectionality of multiple factors, the students' multiple social identities, how family cultural messages affect the decision-making process, and ultimately providing a safe and confidential space in which to explore options and support a student in what comes down to their personal decision. It is not about us making a judgment or imposing our own values, beliefs, or belief systems on our students. Therapeutic interventions have shifted over the years, but the tenets and foundation of ethical mental health care and the processes that are involved are very similar now as it was back then.
I really, I think, preface some of my remarks earlier with my response to this question. If you recall, the focus on students at the center, and you hear that in Dr. Aceto's comments as well. The broad range of support we work to provide, from medical, psychological, and financial. And then our working relationships that have stayed the same in terms of whether that's the partnership at this point, the task force we pulled together in current day, had a large number of faculty, staff, individuals from Michigan Medicine and from the central campus. And we formed then a central campus kind of subgroup to work on the needs of students on the campus, different from thinking about the needs of patients in the healthcare setting. And so, while that's a little bit different, what's at the heart of it all is still the partnerships that are there and our unwavering commitment to our students.
And can I also ask you, as the legal landscape shifts, how do you expect student concerns about abortion access to impact the work that you do in your department? And I'll start with Dean Blake Jones.
Yeah, certainly we're all watching the legal landscapes very carefully. Historically, when the reference and the advice came from legal counsel that was sought by the administrators, our Office of General Counsel provides that type of advice and support to all of us working on the campus. And I think the most significant thing that we're looking towards that could impact our services is if we were in the case, as our colleagues years ago were, where suddenly services could not be provided in the state of Michigan, then a lot of things shift and change, right? The demand for financial assistance and support, I would imagine, might dramatically shift. And those other values-based work and the way that we do our work, would be a constant, but we would be responding to, the legal situation as we need to do. Christine, you want to add to that?
I think, in connection with what Dr. Blake Jones just mentioned, it really is going to be critical to continue building on our network and the collaborations between our many different offices. We've been doing this through the many individuals who make up the U of M Host Road Task Force, very similarly to what the original 1969 U of M task force did, which was to identify this network of experts and key resources in the community in order to help support students gain access to what they need, from legal counsel, guidance to how we're providing support medically as well as therapeutically, to financial access, and to how we communicate in a timely and relevant manner to our U of M community. It will be really important for all of us to work together, share our knowledge and expertise with one another, with the ultimate goal of helping students access the care that they need most. And it'll also be important to be mindful of how our students' multiple social identities can directly impact the type of care they receive and the ease of access to appropriate resources. I want to emphasize the continued importance and work in cultural humility, as well as diversity, equity, inclusion, and social justice in all of our offices and departments.
One thing that was notable in the report was, of course, in the, oh, sorry, you hadn't had a chance to respond yet. Go right. Oh, yeah, sorry, go ahead.
Actually, I began, so I'm good.
Oh,
But
okay.
I didn't know if. Brianna wanted to respond.
Well, actually, I'm bringing you in on the next question then. Sorry for my confusion there. One thing that's really noticeable in the report is how the boundaries of the university were much more open to the community in the past. Because of course, in the past, abortion is illegal in Michigan for everybody. The students are not in a different situation than community members. And there was a lot of collaboration across the community. So how do you see that now informing the future you envision for reproductive health care in the university community? And I'll start with Dr. Asidao, but let's also hear from Rihanna if you have more comments about that very interesting feature of change that you point out.
Definitely. I mean, collaboration is critical. It is key. One of the things I've really appreciated about the work done by U of M in the 60s and 70s was really using each other's expertise areas and vetting the resources they were referring students to. That took a lot of work, a lot of dedication, a lot of energy. They were also really protective of students who may be targeted by for-profit agencies that were significantly more expensive and cost prohibitive. I think it's important to understand our history, what worked, did not work, and apply these lessons to what we are experiencing today and what we may be navigating in the future. Again, with the slides that Dean Blake Jones shared, a lot of the things that we're doing was also done in the 60s and 70s. And underneath all of that was a lot of collaboration, a lot of support within Michigan, but again, with the clergy collaborating with colleagues across the different states. That was really key. And I see that we're doing that again now.
The thing I would add about collaboration, I feel like I've said this several times, however, we are building on a foundation of practice over the years since the 60s and 70s when we were looking at this. We're also building on a foundation that we've spent the last couple of years looking very intently at the mental health and well-being needs of the students in our community. And instead of, because we're such a large decentralized place, and there's a lot of good that comes from that in terms of what we experience at Michigan. But when a student needs to traverse a large decentralized place or a comprehensive issue commands our attention, we know that collective impact and working together, not just even in the 26 departments in student life, but across the span of the institution, the task force, as I said, Michigan Medicine and Central Campus, right? Well, in our student mental health work, we noted that we were siloed in terms of all the work student life was doing, and then the issues as they would manifest themselves in academic affairs and in the schools and colleges. And now we've spent the last 2 years really focused on that partnership, and this work will benefit on that and continues to build. Similarly, our social justice work has originated and evolved in the same sort of way. And so I am hopeful about that. I'm also, again, we've talked more about the campus collaborations than the beyond campus collaborations, but those are equally strong in my mind. Brianna?
Yeah. So I think that there's a couple of directions that this could be taken in. I sort of obviously, as someone from this area, I think seriously about the disparities in abortion access that existed in Michigan and even in Washtenaw County before Roe v. Wade was overturned. I think it's very important. I didn't get to talk very much about it today, but in the report, there's a lot of great information about how the University of Michigan Task Force helped to set up and support abortion clinics around Southeastern Michigan, including in Detroit. And I think it's interesting to think as we have expanded and grown and developed a greater level of expertise, there's incredible thinking going on at this university in both sort of the academic classroom side of things where people are thinking about abortion access and at Michigan Medicine. And I think thinking more expansively about how we can be good neighbors in this time is very important. And it also connects to the second thing that I've thought about is the connection between abortion pre-Roe, which was very national. We have people traveling, we have communities working together across states to develop resources and to build models of care. We sort of have an opportunity again as an institution with many resources that draws in students, faculty, and staff from across the country and around the world to consider how we can connect with other movements, other institutions. I think sort of very closely about our neighbors in Indiana and Ohio, about what we can do to connect across state lines and to rebuild the networks that were necessary then to ensure everyone access to care.
And now I'm guessing we probably have some questions from the audience. So Allison Alexi, the Irving director, is going to share some of those for the panel.
Thank you very much. I wanted to start by saying we have a comment from someone on Zoom in the audience saying, I just want to express my enthusiastic gratitude for this wonderful presentation. Lots of great information. So I thought that was the first thing that came in and is very true. And then a question from an audience member. For Rihanna, what did you find in the archives at UM that surprised you about the history of abortion access in Michigan? Also, is UM part of this bigger story you told us about clergy involvement in facilitating abortion access, or is there anything exceptional about UM?
Okay, there we go. So those are both great questions. I'm going to try and hold both of them in my head without forgetting one. I think there was many sort of different surprising things. I think the 1970s were a fascinating time in the history of the University of Michigan and the history of colleges and universities across this country. Something that I didn't get to work on a lot in this report, but that I would be interested in thinking more about are the sort of larger anxieties in this moment about how sexuality is changing on college campuses. There was a lot of anxiety from letters and between administrators thinking about students living on like dorm floors that had men and women. There was a lot of anxiety about birth control pills being accessible on the campus. And there was anxiety about these things from many different groups across sort of the ideological spectrum. You saw it from feminists, you saw it from, I'll say anti-feminists, which is really how they identified themselves at the time. But seeing these sort of anxieties and concerns, I think is really interesting for thinking about how the University of Michigan administration came to a consensus that they would take this approach when they really were receiving some real backlash for having birth control clinics and talking to students about sex and sexuality. The second piece that I would say is I think what made the University of Michigan special is the contribution that Len Scott made to developing a protocol for counseling. You'll sort of see there's a lot of word changes going on between organizations, and the organizations weren't entirely settled on their names. But the original clergy consultation service uses a different word than the task force for problem pregnancy counseling. The emphasis on counseling was really about making sure that students were emotionally and psychologically supported, which is really not an emphasis that the clergy in other places were able to make when they were so focused on connecting as many people as possible to care. And that was sort of the same situation at the clinics, where there was such a demand for services that there was very little opportunity for counselors to spend time with individuals who are making really challenging decisions, who were doing something that they couldn't necessarily share with their family and friends because where they were from, it was illegal.
So another question is, has the role of alumni changed over time? Are there more vocal anti-choice alums now that the issue has become so politicized?
Any of you want to take a stab at that one?
I mean, I don't have the numbers or anything, but I think as a country, we have been, I mean, the politics have been so polarized. And so the University of Michigan is a microcosm of the greater country. And so, yes, we are seeing that. I don't know how dramatically different it is from the 60s and 70s, because that was also a very polarizing time. But yes, we are seeing very vocal folks from both sides.
I don't have anything to really add to that. I concur with what Christine's assessment.
Is UM doing any advocacy or political work to combat abortion restrictions here in Michigan and elsewhere? It's an open question.
I'm not sure the panel folks will necessarily know the answer to that, but does anyone have a?
I mean, it's so complicated. Advocacy work, yes. Politically, that's tricky. So I'm not sure. We just had her talk on. So yeah.
Yeah, we're hesitating because we're not the experts in answering this question, but as most of us probably experience being part of this community, there's a public institution, there are restrictions politically as to what any of us in the performance of our duties can do, right? And so we have to be very mindful of that at all times and adhere to that. Advocacy on behalf of student needs or student support is different. And so, and Christine already, differentiated that.
I would also add really briefly, thinking about the work that's happening in the history department and the women's and gender studies departments that I'm a part of. There are many faculty members who have lent their expertise and testified as expert witnesses in cases involving the constitutionality of abortion across the country. So I think that's it's a very interesting role that historians don't get to play very often, but the University of Michigan has many people who have who've had that experience and who have done that service.
Is the university's general counsel's office looking at the legality of transportation across state lines to get access to legal abortion should it become entirely illegal in Michigan? Are there any preliminary thoughts on this?
I can try to take that. The simple answer to the question is the Office of General Counsel is looking at and trying to anticipate any realities we may encounter in the future, and will advise on that. I don't have anything preliminary to share about that particular nuance.
Let me invite more questions from text or people on Zoom. I've read all the questions that I've got in front of me right now. I think I have a question in my head, unless Anna, if you, I have a spare one.
Okay, well, I did have one that the panelists got to see ahead of time, so they're just to give them one that they're a little more prepared for. How do unplanned and unwanted pregnancies impact our students now? And what do you see as their most pressing needs now?
You want to go? Okay. I mean, just like it has in the past, unplanned and unwanted pregnancies continue to affect our students today. I mean, that's going to continue. How it impacts students, again, varies depending on their multiple social identities, socioeconomic status, and family cultural and social support. Each story may be different, but something that is critical in the work that I do is to understand the multiple factors that may affect a student's current situation and how this may affect their decision-making process. What is most pressing is having access to relevant and accurate information, a safe and confidential space to voice their concerns, and expert professionals who can best support students, as well as are knowledgeable of the resources available to our students, or who can point them to other experts on campus. Again, it just really takes our entire community to support our students, and we're going to continue to do that.
Yeah, I would add, and we've talked about some of this before, but the pressing needs become housing, childcare, financial support, the ability to have emotional and medical support. I mean, all of the things you would anticipate would come up for an unplanned or an unwanted pregnancy. And one of the things we haven't talked a whole lot about is academic accommodations. And so, you know, a student could have academic accommodation needs because they're recovering from a medical procedure, they're traveling for a medical procedure, they're needing to miss class at the end of a term because they're having a child, and then they need some additional time to recover and come back and take their midterms or their finals. So, you know, we see the whole range of needs of students and, you know, respond at the individual level with as much wraparound and breadth of support that we possibly can for each unique situation.
And Allison, would you like to share your question or others that have come
Actually,
in?
there are other questions that have come in.
Oh,
So
great.
thank everybody for supplying such good questions. So this person says, thank you for this talk. Can Rihanna speak more about the moral imperatives that clergy expressed around the problem pregnancy counseling?
Yeah, so I think the largest theme that I would pull out from this presentation is thinking about moral authority and who in our culture and in this country possesses the sort of privilege and role of determining whether something is right. I think that's something that's going to come up for us a lot in the coming years as we sort of return to these debates that have been happening for many, many years. I think something that I found really interesting about doing this research is to see the disconnect between feelings about morality from the actual people involved in counseling and the service that they were able to provide for others. Something that I found really interesting in the presentation, not in the presentation, but in the research, was that Len Scott, in part of his letter to Thomas Quinn, talks about believing himself that abortion ends a human life. And you can sort of see that this person who worked tirelessly for decades on this issue, if he felt this way and he found a way to acknowledge and to believe the moral validity of others, to me, I find that to be a really powerful story when thinking about the polarization of the world that we live in. That individuals can take their own beliefs, but then also look out into the world and see need and see and ask, what are my ethical responsibilities to others? As was mentioned earlier, the Office of religious affairs doesn't exist anymore. But before it did eventually shut down, it changed its name to the Office of Ethics and Religious Affairs. And I think that speaks in part to this question that's more than morality and has this sort of ethical component as well.
So another question for you, Rihanna. What role did student advocacy play in the pre-row services provided by UM? What role do you see student advocacy playing in the post-row landscape?
Yeah, I think that's a great question. You can see it in many different areas. I would say primarily in the ways that the Problem Pregnancy Task Force collaborated with other campus groups. They worked with the Women's Crisis Center, which was run at the time. And they also worked with graduate students who were brought on to the task force and who helped them do some of their evaluations of clinics, primarily students from the School of Public Health. Now I currently think there's so much for students to do. It depends what kind of student you are. If you're a medical student, that's going to be different than if you're an undergraduate in the sort of access you have to directly participate in increasing abortion access. But for undergraduates, I think thinking about this presentation, it is a reminder that of the importance of speaking up and sharing the needs that you experience and feel. The way that students came into this project most commonly for like throughout my process was through the Michigan Daily. And the Michigan Daily was an incredible resource for both chronicling what was happening at the university, disseminating resources, and connecting students with care, and for making it clear that this was important. I cite an article from the Michigan Daily editors on the day after Roe v. Wade was decided, celebrating how long it had taken, celebrating what had been accomplished and mourning how long this had taken to occur. And I think that's sort of a reminder of the sort of influence that undergraduates and students of all kinds can have on the university and how they can impact what services we provide and what directions we go in.
So let me invite again any questions. I know at least for me, it can be hard to type and listen at the same time. So I really appreciate you can make your question as short as you want to our online audience as well. Maybe if it's all right, I'll ask my question. I was really struck by the paradox or the seeming paradox of privacy and publicity and the need for both in what you describe in your report and what you described in the presentation. So I was thinking about that in this age where it feels to me like we're swimming in information all the time, but that can also be really isolating because there's so much information that it's hard to figure out what's right. And I was thinking about this in relation to when I teach a large lecture, Introduction to Women's Studies, I let students vote for 1 week's topic. So I let them nominate things, and it didn't win, but one of the topics that got really popular was actually just a week on sex education. And so we started having a little bit of conversation about that, and students were saying, depending on where they went to high school, they really didn't feel like they had that good information, whatever that means. And I take both of the points that were raised. There's tons of resources on campus, but I think you also both implied at least that even if there are resources and information available, it can still be really hard to find precisely because there's so much beyond the fact that we have a smartphone like on our person physically, right? So I was just wondering if you could maybe think out loud about how privacy and publicity relate to each other now, or the sort of tensions that you think students might be processing.
Yeah, I think there's a lot there, and I really will think out loud with you. I think it's interesting and something that's been a very sort of common conversation between myself and some of my peers and my classmates is thinking not only about how much information we have now, but how much information about ourselves is shared and tracked in the world. I think as we sort of enter a moment where we're rethinking what role police and the state will have in regulating reproductive healthcare access, I know that that is a very sort of serious concern. Though at the same time, I think it will be interesting to see if laws change, how are they enforced? What does that look like? An interesting story from doing research on the Michigan Clergy Counseling program. There's so many names for it that I'm always like combining them. They have an incredible story about a police car showing up to a clergy's apartment as he was preparing to meet with someone to travel to see an abortion practitioner. And at that moment, he was very nervous because their phones were being tapped. Other clergy in Michigan were arrested for their work. But he went out to the car and he saw that in the police car was a father who had brought his daughter to get care from the clergy. And I think that's sort of a reminder of what is to come in this moment where we're easier to track than ever, but that we're dealing with an issue that's been brought about by a Supreme Court that's been largely appointed by people who were not elected by the popular vote, rather the Electoral College. So I think we're going to have an interesting moment, not necessarily in Michigan, but in other states, as we sort of all deal with how do we connect about these issues? How do we organize when social media is a tool in many ways for the police? How do we, I think of the part thinking about university financial aid. What is there now that shouldn't be written down that will happen within communities as individuals support each other? That's where I go when I think about information, though I know that's not entirely the question.
I mean, I think it really is this balance, because what I don't want to see happen is that people aren't talking about things that are important, that can bring up a lot of shame, a lot of secrecy, and that's not helpful. And so I feel like for us as staff, faculty, really making sure that we are talking about media literacy, understanding where these sources are coming from, and then doing our jobs in regards to, especially when we're disseminating information, making sure they're really vetted, really knowing where the original sources are, and that it's coming from a place of real expertise and knowledge, and really encouraging our students to also really talk about these topics in such a way that comes from an informed place. So it really is about, and even just thinking about the privacy, there are some of our units, mine being one of them, where we are a confidential space. And so anything can really go, in terms of talking about what's going on. Like, our stuff is protected because of laws and ethics. But some other offices, really depending on where the laws go, that may impact sort of what they're able to do. So again, being very aware of how the present is going to be affecting our ways of disseminating information, how we can have conversations on really sensitive topics. That's something that we're all going to be wrestling with. But to also just reiterate, with the task force that we're on, these are all things that we have been talking about for months. And we are trying to prepare for a variety of different scenarios so that we are prepared and that our students and our communities are as well prepared as possible.
Yeah, I don't have anything specific to add to those very thoughtful answers. However, to the previous question about student activism and engagement, the thing I would have added then is that, as we look back at the history of the university, I have a 13-year history of being here at this university, but 27 years of practice in higher ed at other institutions as well. And what has been true no matter where I have been, and certainly been true here, is that so much progress and forward momentum and improvements that happen in this community and on our campus are because students speak up and are supported. And what's really affirming to me is watching the student community here, the community of leaders, and how folks have rallied around each other and with each other. And in spite of the fact that, yes, there's wide ranges of opinions and values and beliefs, and there's also, such a polarization elsewhere that people are seeing, I continue to be encouraged by the fact that Michigan students and the student leaders I work with day in and day out are really behaving very differently than that.
Thank you for all the questions that are coming in, everyone. This person says, amazing presentation. Rihanna, has this research changed how you think about abortion access? Was there a tool that is most needed to increase access that you hadn't thought of or didn't maybe realize was so important?
Yeah, that's a great question. I think, I don't know, I think it's very interesting sort of growing up largely in a moment where abortion referral has become a much less sort of popular practice. It definitely is something that happens in certain places and within certain groups and organizations that make that their mission. But I think something that really struck me when thinking about clergy counseling and thinking about that in the moment that we're currently in of the pandemic, a real emphasis for both the clergy consultation movement and the counseling that happened at the University of Michigan was being in person and talking to people face to face. And I think that for me really made me rethink sort of in a larger picture what it means to help someone and what it means to connect someone with the resources they need. I think in the time that we sort of live in, and as you sort of talked about before, there's so much information. And so often the way to cut through that sort of like word cloud of information and resources is to actually talk to people and to find out what they need and to have that communication be personal. I think that's something that I'm thinking a lot about through the sort of different organizing efforts pop up, as different organizations that I support as I get more involved in this moment, is sort of what it means to be present and what it means to connect and to like more largely connect people to the things that they need.
That just reminded me, I referenced our student mental health and well-being work a few minutes ago. And the work that's being done really falls into 4 quadrants of work. And one of them is developing the skill set of faculty, staff, and students in the community to make, to boldly intervene as a bystander where needed, to make warm handoffs and referrals. We use the example often of a faculty member might be granting an academic accommodation to a student who's shared that they've had a death in their family. Does that person also know how to get them connected to CAPS? And so working to make sure that we are at our best as an institution to serve our students is a really important part of this.
This person asks or says, I was surprised to learn in Rihanna's presentation that staff and faculty with unwanted pregnancies were also assisted. Is that due to an artifact of that time, or is the university likely to continue to have an abortion response that applies to all 3 groups?
I actually think that might be a better question for you two.
I just want to, I'm not sure if I'm getting that question exactly, but in regards to the task force, we are looking specifically at students, but we're also looking at faculty and staff and making sure that they're getting the support that they need. So there is a coordinated effort. It's just we're in student life. And so our main focus is on students.
Yeah, the focus in Michigan medicine in terms of where many faculty and staff of the university get their healthcare is certainly covering that part of the population as well. The work that's being done to understand insurance coverages broadly applies to students as well as to faculty and staff, but we are not the faculty and staff experts.
Have we reached the end of questions from?
From at the moment, yes. So
Well, how about we do that? How about we have a last word from each of our panelists? And then I have an announcement about an upcoming event that I'd like to have a second to show. So how about we just go in the order moving away from me with Rihanna, starting with the last word. Any last thoughts you'd want to share?
Yeah, well, first, thank you everyone for coming and for engaging with this work. I think it's an incredibly rich story, and there are so many, there's so many intersections between this story and other movements and moments at the University of Michigan that I wish I could have touched more upon. But I think the things that I would really sort of emphasize here at the end are some of the lessons that we get throughout this piece. I think it's important to sort of return to the idea at the beginning shared by the clergy consultation service that abortion is so largely an issue of social inequality that cuts across the lines of race and class, networks, access, privilege, sort of all of these like big ideas and words that I think have been touched on so well today in sort of thinking about what the university can do to address those disparities. I would say that is a huge thing to take forward. And there's so much more. And I hope that anyone who is interested will reach out to me if you have any questions. And keep an eye out if there's any more to come of this project. I think there are so many things, as you can sort of tell from this Q&A, that didn't make it in, but it's a incredibly sort of, I don't know, it's a moment that sort of stretches, and we're sort of lucky to have the incredible resources at the Bentley Library to tell this story. Yeah, and I think my last thing that I would say is that I hope that everyone working on the Post Row task force right now is saving their emails, keeping their notes, and that if you move on from U of M or retire, that you'll donate that to the Bentley. Hopefully, we won't be meeting under these circumstances in 50 years, but I think we are sort of lucky to have incredible archival resources here.
The two things I would just say in closing, as I said at the beginning, being able to read the paper and look at the history that informs the work that we're doing today is so important. And, you know, some cultures are far more deferential and like to look at the foundation that they're standing on and appreciate what has come before than others. And so it was a really poignant reminder to me. You know, I've, as I said, I've worked for a long time in as a student affairs administrator, and I know the history of the profession, but even digging deep into the history of an issue at the campus that you work at, you know, I was actually a college student in 1979. And so I experienced that from that lens, but being able to see the incredible work that people did to build the foundation that I'm standing on now to do the work that I do was just really important. And then my second thing that I would say is that to all of you that are here today, you know, all of this work takes a community, and even the work of understanding at a decentralized place how to find the resources when you need them takes a friend that can point you in the right direction. And so I think we all play a role with that. And I just hope you've learned a lot today that you'll be able to pass on and our community be better because of it.
And just wanted to say thank you again to Rihanna. This work is so fundamental to really moving forward. Our history does inform us, but we need to have access to our history. And so I think archiving and doing that research is so key, because if you read this paper, it really provides us with a guide on how to do the work now. And that is so critical. And I think that intersectionality piece, I just really want to emphasize that this is a social justice issue. We need to know what has happened. How does it affect our different student populations? Again, depending on their different identities. We want to make sure everyone has access to reproductive health care and safe abortions, and to just, I don't know, because I hear the stories, I hear the individual stories, and each story is really poignant and is so influenced by so many different factors. And if we could, as a community, really be empathetic and compassionate and really listen to what is going on, I think it will help us, again, provide the care that is needed for the many, many different students and faculty and staff that we serve. So this work is critical. So again, thank you.
And with that, I'd first like to put a plug for the next event that IRWIG is hosting related to these issues. Yamani Hernandez, reproductive justice advocate, will be here on October 20th. You can see the event details right there, and it is a reservation required in-person event. And just to close this out, I would really like to say thank you to our panelists, Dr. Aceto and Dean Blake Jones. But I think the real hero here is Rihanna. I mean, this is just amazing, amazing work that she did. And the librarians, they told me, there's some really interesting stuff in there we should take a look at. And I always listen to librarians because you just should always listen to them. And so what we found was really remarkable. And I think the work that Rihanna produced is just beautifully written, fascinating on so many levels. So I do hope you all will download it from Deep Blue and give it a read and share it with your friends. And so thank you so much for coming on Zoom and in person today. Thanks a lot.